Although creating cures is the ethically beneficial object of the healthcare system, creating customers is the financially effective intent. A cure is a procedure or substance that ends a medical condition. While establishing rapidly effective cures would immensely benefit patients, it would challenge developers seeking continuous cash flow. When developing a cure, developers want to create something that will bring in money for a long period of time as opposed to curing the problem and moving on. There are many diseases and disorders without a known cure. Hepatitis C was one of these until 2013. In an article by Dr. Milton Packer, it poses the question, is curing patients a sustainable business model? If a new drug that cures patients rapidly is developed, the patients will not have to take it for a long period of time. Therefore, the money that a company can make is restricted. Dr. Milton Packer uses hepatitis C to demonstrate this. In 2013, a cure for hepatitis C was released. The cure was a series of drugs that cured it in only 12 weeks. However, the price was a huge downfall. It cost $94,500 to receive the cure. Even with these enormous prices, Goldman Sachs was not satisfied. Goldman Sachs is an investment company that provides financial aid to companies to explore cures. This becomes an even larger problem when the disease being cured is a transmittable disease. It notes that the U.S. sales of hepatitis C treatment peaked in 2015 at $12.5 million. Since then, it has declined, and Goldman Sachs estimates that it will be at only $4 million this year. In Dr. Milton Packer's article, a quote explains, in the case of infectious diseases such as hepatitis C, curing existing patients also decreases the number of carriers able to transmit the virus to new patients. Thus, the incident pool also declines. This means that if we cure a transmittable disease, less people will get it. Therefore, we will have less patients who need the cure. Money is the key motivation behind big pharmaceuticals decisions. Cures cannot be made without adequate financing, therefore investors play a large role. Investors' main goal is making sustained cash flow. Instead of investing in a drug that cures a patient in one dose, investors would rather a less effective version of the cure. This would ensure that the patients would need to take it longer, making them a long-lasting customer. If a treatment that can cure a patient in one dose is released, investors will ensure that the pharmaceutical company prices at outrageous prices, putting it out of reach for most average people. The influence of the investors causes pharmaceutical companies to rather create customers opposed to cures. If a pharmaceutical company wanted to create a highly effective cure, it would likely be hard for them to get financial aid from an investment company. While people like to believe that the healthcare system has everyone's best interest in mind, often they have other motivations. Big pharmaceutical companies are creating ongoing customers rather than cures. Money is the main motivation behind anything done in the healthcare system. Without funding, it is not possible to create cures, so pharmaceutical companies fall under the influence of their investors. Healthcare often is treated like business, but it's so much more. Everyone's lives depend on the healthcare system, so morally, they should have their best interests out for the people instead of the money. With all this being said, how does society know that pharmaceutical companies are not withholding groundbreaking cures so that they can keep their recurring customers coming back?